All right, good afternoon, everyone. Thank you for taking the time out of your day to jump on. Um, I know you're probably waiting for the day when we're going to get back in person and have a quarterly first responder breakfast instead of a meeting, as am I. Unfortunately, it probably, with the rate things are going, probably won't happen this calendar year, but hopefully sometime soon we can get back in and have some breakfast and sit together in the same room. But for today, we are on Zoom, and we have Carla Bayonet here. She is going to go over when it is best to call us and some of like when to make a referral, how to make a referral, some of that process, what that looks like. And then after that, we were hoping to just kind of open it up and kind of share what we've been seeing in homes, some of the trends that have come through the call center, and then as well as any first responders that are on the call, anything that you've been seeing, hopefully you'd be willing to share and see how they compare to us and how we can help each other out with some of the issues and everything that are going on. So without further ado here, I will turn it over to Carla if she's ready for us.
Sure. Good morning. I see a lot of familiar faces, so I don't want to go over too much that we all already know, but I want to welcome any of our first responders. Thanks for logging on and learning a little bit more about Direction Home. I believe most of you are familiar with who we are and where we are in the community, but I just wanted to kind of go a little bit more in depth with the when, the why, and the how of what we do and how we kind of bridge our services to help you with what you do and keep our people in the community safe. We want them safe, protected, and having as many available services as they can. So one of the best things I like to start with are trends. What type of things are we seeing on our end and what type of things you're seeing on your end? Feel free to chime in anytime. We can have more of a dialogue, a discussion. I hear on our end a lot of failing at home due to isolation, lack of family support, and lack of finances, or the inability to know who to ask for help. That's a big one. If someone needs assistance, they don't know who to call. They don't have Google. They're not able to just check the best person, and they're scared. They're scared of calling a contractor who might victimize them in one way or another. So it's difficult. Then the repairs don't get done. And again, their health fails and the situation in the home fails. And then we see them in the hospital, nursing home, death. We don't want that to happen. That's a hard cycle and we see it happen a lot. So at Direction Home, we want to be there before that spinning begins. So one of the ways that we like to connect are through information sessions like this, and any way that we can send you information, connect with you, always feel free to call us. You'll hear me over and over say, just call us. If you have any questions and you're not sure if they need help, you're not sure if we're the right agency, call us. Always err on the side of give us a call. And if we can't help them with one of our programs, we can make sure that we bridge them to other programs that they might be eligible for. Not every problem gets solved on the first call. Sometimes it's multiple calls. Sometimes they start in one program, such as care coordination, and then they move to another program like Passport. So anytime, just give us a call. We have a great brochure and we're happy to send it out to anybody that wants it. It has our information on the back and Courtney will send it out to everybody so that you do know how to reach us. The easiest way to reach us is some project that we've been working on recently is a closed loop referral project. And Jessica's thinking, oh, I'm on that project. I know what's happening there. We want the professional referral to come in quick and easy. And we've done that by putting a button on the website. You go to our dhad.org and up is the front screen, and right there's a big button that says make a referral. It's a fillable form with your name, their name, and any information you can give us. We'll take just a name and a phone number. We like whatever you have, but just a name and a phone number is great. physician information if you have it. If you don't, that's okay. We've got some questions related to that fillable form, and that goes to the why. Why would you want to make this referral? Has there been a recent decline in their health? You went out, you found them on the floor, they're more weak. I came home from the hospital, I had a fall, but I'm better now. But you can clearly see we've been out there twice this week, once last week, and they seem to be getting weaker. Give us a call or send it through the email. Have they been to the emergency room in the last 60 days? Very few people go to the emergency room and come home stronger. So we want to be able to help, even if it's just with an emergency response button and meals. Those are very helpful things as someone's recovering. Maybe when you get there, you see signs of caregiver stress. Very, very important, especially during COVID. This isolation has caused a high level of stress, not only for the people who need assistance, but for the people who love them and care for them. What did you think about the home? How did it look? Did it appear unsafe, unkempt? We can help with that also. We have a housing specialist that does an amazing job. We have programs that have grant funded money to help with small minor home repairs. Sometimes it's easy if we can get the furnace turned back on. If they don't have a furnace, they can't stay there through the winter, and then they decline. Have they had a recent medical procedure? As you speak with them, you find out that they had a fall, that they had surgery, something like that. You're learning a lot as they call you at their time in need. So we want to see if we can capture some of that information on that referral form. I can get you the form in paper. You can click on the website, or you can give us a call. Any of those three ways. You can call us during the day, 8 to 5, or I like the online form because you can pull it up if it's at 2 o'clock in the morning when you're responding. You can get as much information in there and just get it over to us. So that's very helpful. Courtney was kind enough to put the phone number for our screening department in the chat box, so if you need that. So we did the when to call us and the why to call us and the how to call us. We talked a little bit about trends. Is it okay if we open it up and you can kind of tell me some of the things that you see in the home, and maybe we can start to work through those?
I can start off with that one, Carla, if you don't mind. I had a care manager that was not able to make it on the call today, but she sent in a couple of things that have been concerning her that she's noticed since going back into the homes. So she said, so far the biggest issue of concern I have is lack of medical care due to no transportation and or not understanding Medicaid coverage for medical care, and lack of medication due to lack of transportation, not receiving medical care, pharmacy coverage changes. She spent a total of 2 hours on the phone in her client's home trying to get her medication ordered and delivered. And then she also visited one client whose home was extremely dirty and the smell was potent when she opened the door. Lack of personal care aids is impacting her client's personal hygiene. And she's recently visited 2 who have been dirty, disheveled, and wearing dirty clothes. And none of them have disclosed that over the phone, and not even ones that she had had on her caseload for a long time or had a long-standing relationship with. And they're taking about 2 hours to complete those visits at a minimum due to the severity of what's going on.
Those are definitely issues. I know everybody on this call has seen it and been there. So the first thing is, if they're on a program like Passport, there's some wonderful services for Passport. The minor home modification to fix it, repair small things, and chore service to help them with that heavier cleaning. You know, we've been a long time where people haven't been able to get the trash out, or unsure, you know, they're afraid of falls, they just physically can't do it. So chore service is available to someone on Passport. Exterminator services on a limited basis are also available. If the bed bugs have gotten in or other types of vermin, they can handle that. A lot of what it comes down to is if someone's on the Passport program and they have aid hours authorized, there is a really difficult aid shortage right now. We have a direct care worker shortage, and it's impacting the care that we can provide in the community. I know one of our committees, I believe I'm going to ask Jessica to chime in. It's a direct care provider shortage has caused us to start looking at how can we assist people. Our provider management group has a committee, and they're trying to get more, or Becky, you might be more familiar with it. Are you working on that committee?
Yeah, we are starting a program that we're putting out information to everybody about being trained to become a home health aide. There's some of our providers that are hiring, we're desperate for people, and they provide the training. So we've started that and sending that stuff out. But yeah, it's very, very difficult out there right now. Jessica might be able to add more since it's a project management thing.
There's a lot of bumps in the road, and for sure, one of the biggest bumps in this road is the lack of training. I'm sorry, Jessica, go ahead.
Wasn't really going to add much. Go ahead and continue.
If anybody's ever worked with Medicaid or any governmental agency, lots of red tape. And it's really difficult to navigate all of that red tape when you're a caregiver and you just use your phone. You know, that's all you use, and you're trying to fill out forms. You may not have access to internet. If you've gone to the library, libraries were closed for a long time, or if you've gone to the library and tried to use one of their computers, they may not have one at home. There's a lot of barriers to finding out what programs are out there. What do you need? Who can tell me if I'm eligible? Then how do I get the training? So this wonderful project that they're working on is going to help break down some of those barriers and possibly get more direct care workers into the system. So that's an ongoing issue, and we're very cognizant of it and working hard. The medical transportation, that is such a hot button, and that is hard. If someone qualifies for the Passport program, there is Medicaid's, well, if they have Medicaid, they can get net transportation, which is non-emergency transportation to and from the doctor. And on waiver services, they get a case manager to help them with those transportation services. If they call the Aging and Disability Resource Service, we're sure to get them connected with the net transportation in their area, or whatever form of transportation we can find. We have a resource library that we keep up to date. Every quarter, we go through a big chunk of it to make sure that it's all current, and we give out any resources that we can to help people get to the doctor. Any other trends or issues? Anything that we can kind of work through and troubleshoot? Tracy, you look like we're going to say something there, so no.
No, I think from the care management standpoint, you know, our biggest challenge is the shortage of direct care workers. And, you know, I think a lot of people look to us for that service and to help supply that. And a lot of people need that. And when we don't have it, it's just such a challenge. And it's not that we aren't trying. The care managers try. They make lots of phone calls to different agencies and do everything they can to staff our folks with a care provider, and there just aren't enough. And it's just a challenge.
Yeah, and I think as an agency, you would all agree, we work so hard to advocate for an increase in funding for the direct care workers. We want it to be a career, not just a job. We want caring for family members, caring for other people in the community to be very, very important and paid at a rate that is livable for that caregiver. Caregiving is tough. It is stressful. Teresa, if you have just 1 second, I'd love you to talk about caregiver stress and how we try and identify it and mitigate it.
Sure. I'm Teresa, and I'm the Family Caregiver Support Specialist here at Direction Home. It's a fairly new position, and we started this knowing that especially with the professional worker shortage, a lot of family members were having to step up and take care of their loved ones, or maybe the adult daycare had closed because of the pandemic, so they were no longer able to go to the daycare while their family member worked. So we focus on our end, supporting and helping educate the caregivers that are family members, friends, could even be a neighbor, not the professional side of things. We really want to focus on those people that are unpaid and help them learn how to deal with the stress, how to educate them as far as different disease processes and what to expect, and then just offer support to them in general. We do have a wonderful Zoom online support group going right now. Gosh, it's been a year. I can't believe it's been a year, but we've been doing it for a year now. And the caregivers seem to love it because they don't have to leave their home in order to join. So maybe their loved one is just right in the other room and they can hop off if they need to help them with something. We have speakers that come to the support group as well to educate the caregivers on stress reduction, on, yes, Lisa Mansfield, very good point. They could be at home or they could be working and taking their lunch break to hop on to the support group with us, which I know a couple of people who attend do that. So the Zoom platform has worked out really well during the pandemic. We have some speakers every now and then to educate the caregivers on maybe Alzheimer's disease or other dementias, fall prevention, safety issues, planning for the future. We partner with Summit County Probate Court for planning for the future and educating people on where to, basically what they need to know as far as end of life planning or even healthcare and financial planning. And sometimes it's as simple as them not even knowing what to ask. So we make sure that we kind of start small and just go from there. We also offer a lot of resources. So if you think that there's somebody in the community that just needs a resource, maybe they're not ready to join a group or it's not something they're comfortable with, you can always send me their name and number and I will reach out to them by phone and just offer my support and any resources they need.
That's wonderful, because if we have a competent, strong caregiver, we get better outcomes. So we want to make sure, and we want to help people and partner with those caregivers to see how we can help them develop that care plan that keeps them in the place that they want to call home. That can be home, family members' home, assisted living, wherever they want to be, at group home. We want to help people with that. Just a quick overview on some of the programs. Passport program, you'll hear that name for all of what we do, but it's really a program for home and community-based services for people over 60. Ohio Home Care Waiver is a home and community-based service program under 60. Assisted living waiver that provides beds at beautiful assisted living facilities in our community under waiver payment. We help with that, 21 and over. We have the caregiver support. We have care coordination for people who aren't quite ready or able to access Medicaid services, but aren't rich enough to pay on their own, private pay. We have some care coordination dollars. We have programs, Healthy You and the Steady You programs, and Tai Chi Quan, if I'm saying it properly, to help people get stronger and take charge of their health care. And the ADRC, which is right outside my door, the Aging and Disability Resource Center. If you call, we probably have some answer for you. Yes, this is a problem, here's what you can do. Or we haven't seen this before, let us investigate for you. We want to be the first thing that you think of when, boy, grandma's looking a little disheveled, wonder what's going on. Give us a call, let's talk about it. We can give you some information. So as Courtney has up on the slide, does anybody want to kind of go over other trends that they're seeing or anything that you've come across? Fall hazards, isolation, anything like that? I think we hit on the big ones. I'm pretty sure we hit on the big issues. Isolation, lack of caregivers, inability to get to the doctor, transportation, inability to get to Walmart to pick up paper towels, toilet paper, things like that, the necessary stuff. The inability to carry it. Have you tried to carry your groceries on public transportation? It's very difficult. As we age, we want to help people make a plan for this. And identifying who they are is one of our barriers. We want to know, how do we tell people who Direction Home Area Agency on Aging, who we are and what we do? Because we have a wealth of information that we can share and we want to get it out there. So by meeting and talking about it and trying to meet people where they are, especially professionals, we want to try and help as many people in the community as we can.
Carla, maybe you could go over kind of like how we talked about yesterday with how professionals can sensitively make a referral, or especially now because so much has happened in the past year that maybe you enter a home where everything has always been fine, and then you go in now and everything is not fine, and it can throw you. And I'm sure it's an experience for the other person as well in the home. So how to go about that?
Sure. Our group yesterday, we met with a wonderful group of people in Northern Summit County. Many of them were from different churches, and that worked out really good. And one of the ways we talked about getting a referral to us is, you may not walk up to Mabel and say, Mabel, you look terrible. You need help. You have to call these people. You know, that's rough. That's kind of rough. But you may notice that Mabel is looking a little more disheveled. Her clothes appear to be bigger. She may be losing weight. She's not coming to church as often because she doesn't have transportation. Or you saw Mabel's car parked pretty wonky out in the parking lot. You know, we laugh about she's, you know, taking up 2 spaces because she's got an old Cadillac. Maybe she can't see. Maybe she's not the best driver. So you can always call us, kind of tell us what's going on, and then we can reach out to Mabel for you. We're really concerned about safety in the community, and we tell people all the time, don't just pick up the phone and tell everybody your life. There's a lot of scams out there. So we try and say, hey, I met your pastor the other day. He said you've been coming to the church for 20 years. That's awesome. Yeah. He also wondered if you knew about our services here and there's anything that we could do to help you meet your care goals. And then we kind of slide in from there. That's kind of how we like those professional referrals to come. You don't always know how to approach it, so let us. We can do that. We'll take the lead on that. So building bridges from what other places have to what we have. There's no central site for any of this. I wish there was, but there's just not a central area. We want to be the first place that you call so that we know what's going on in Nordonia, Macedonia, City of Green. What services do each one of these have? So we've been keeping a great list and hoping to build on it over the next year. Miss Courtney is there. Any other ideas or trends, things that you're seeing?
Or any questions too? I know Carla's very busy, so I'm excited that she's here and willing to answer any questions. I always have a bunch for her, so.
We have a lot of grandparents caring for children. So that's a concern. And we do have some resources. We've recently found some good resources for car seats and care and transportation. We've come across some recently. Lack of food has been an issue. Food deserts and the inability to get food to a specific area. We have some resources for that. So there's a lot of issues out there, and we want to tackle them to the best of our ability, but we have to learn about them and make sure that we address them.
I'm not sure. I don't think anyone from Akron Fire I don't think anyone, you can correct me if I'm wrong, from Akron Fire is on the call today, but I was on a call a few weeks ago, and they had mentioned that they have had a significant increase in apartment fires just in the past month. So that's definitely, the fire hazard issue is kind of ramping up right now. I'm not sure if that's common across the board or just in that area. But that's another concern that I've heard.
That I think that's very true. We've had 2 out here in Green in the last maybe 6 to 8 weeks. People are cooking more. They're more isolated, so they have to be at home more. And they're still seniors. They still have memory issues. And that's been difficult for us. So we were blessed not to have any injuries, but we do have some people who are out of apartments and not a lot to fall back on financially. Thank goodness one of them was able to call here and we got them some Salvation Army services to make sure that they had some food and some clothes to get into short-term housing. Then they needed something to wear. So we were able to help them out with that. But yes, cooking and house fires, I'm sure that statistically they've been on the rise. I know they have been out here. So it's tough. Would anything be particularly helpful to our first responders? Can you think of literature to leave with people, or literature that we could leave with you, or anything that would help you connect us with the people that you're serving? I don't recognize a couple of names there, so I know I've got a couple. Mark Miller, you have a picture, so I can tell that you're a fireman.
Yes, literature is good. Unfortunately, a lot of times it just gets put into the pile with the rest of the mail and the newspapers. Right. I would say that literature being left with family members may be better to kind of help them know what to do.
Mm-hmm. That's a good point. A lot of times people call us and they don't follow through. We send a packet and they don't do anything with it. So we have said, do you have someone that assists you with your day-to-day care, your daughter, your son? Oh yeah, we try and catch that information also and call them and let them know what's going on. If we get a professional referral from hospitals, nursing homes, police, fire, we've developed a closed loop referral system, because a lot of times you call us, maybe they don't want help or they don't answer the phone, and it appears that there's no way, that we haven't done anything. We want to close that loop and tell you we were unable to reach them, or they've since gone to a nursing home, or here's our plan. Here's our short-term plan. Here's our long-term plan. Long-term plan is always passport or assisted living, as those programs take longer to get connected. There's verifications and 5-year look back. So those are very difficult. But short-term plan is we can call them and say, did you follow up? I heard the paramedics were out there to see you. Did you get to your doctor? How's your medicine? You can't get your medicine? What's going on? We try and triage that a little bit. We have some short-term transition programs that are kind of private contracts, which we're hoping to expand because that gets that first call when they're home from the hospital. Did you follow up with your doctor? Did you fill your medications? What's your backup plan? So that people start to think about things prior to getting hurt. Mark, I see a little hand on yours. Does that mean you have a hand up?
Yes, I do. Do you make contact back with the fire department if they make a referral?
Yep. If I get someone to call or an email to send it to, yes, we're going to follow up. It's difficult to reach people by phone. No one answers the phone. So we try and leave a generic sort of a message without giving away too much, because we want them to call us and then we want to expand on it a little bit. So there's a little finesse in reaching out to people. And our screeners, we have 7 screeners and they're really good at it. Mark just took his hat off, his fireman outfit. There he is. Very good. Any other questions or trends?
Hopefully Mark doesn't mind me sharing this, but Mark also doubles as an ombudsman. So very glad to have him on the call today as well.
I do not mind. Actually, this is the first I've heard of this group, so I was really interested and excited to join. Sorry I was a little late. I was out on a call.
That's no
worries.
I think that's very nice. Our ombudsmen do amazing work. If there are issues in facilities, they're right there to help be a negotiator, to make the consumer understand what the issue is and the facility understand what the issue is and really bring it together. They don't go in as pit bulls, they go in as negotiators and help everyone understand the situation and work through it. So very nice. We have a lot of good people and a lot of good things that we do here.
It looks like Rochelle has a question for our first responders on the call. If anyone would be willing to jump in and help out with this one. Do paramedics keep a lost and found, or do they leave everything at the hospital? I have folks looking for their blanket, sheets, ERS buttons, keys, etc.
I can try to answer that. I can tell you what we do. We try not to take personal items if we don't have to, because they do often get lost. Typically, we do not keep them with us. We try to leave it with the patient in the emergency room so that they can keep an eye on it and make sure it doesn't get lost from there.
Heather, did you have something?
I just wanted to share, hi, I'm a care manager. And I just wanted to share that what I see a lot these days is that people who might regularly go to the hospital and then go to a facility, they are resisting going to the facilities because of the COVID outbreak, or maybe family doesn't want them to go to a facility because of COVID. And so they come home, but they're not prepared to go home. So they end up in oftentimes worse situations because they fall or mismanage their meds at home. So a lot of it is just trying to convince people that, first of all, we are able to look at the Summit County data to see which nursing homes have the COVID cases right now. It's on the Summit County Health Department site. And also just getting them to think a little longer term beyond a week or two, because sometimes it's that week or two of services that makes a difference about whether they'll be successful in the long term or not. So it's been really, really challenging, I would say, just more difficulty because of the lack of the home health aides and the resistance to going to a facility for help as well. And I'll have children trying to take care of parents, and they are working full-time jobs or something, and they really can't do it. And so it's a lot of giving information out these days. It just seems like a different job than it was before COVID in a lot of ways.
I agree. The way that we've pivoted to serve the community and other agencies within the community, I'm astounded and so proud to be part of what we're doing here and how we're connecting to other agencies. Heather, that is true. I know people are afraid. They're afraid of nursing homes. You know, all over the television, they talked about how nursing homes, everyone's dying, they're locked down. That is a scary thought, and that's definitely a barrier. And I think we're blessed to have great case managers who take the time and talk with their consumers about these fears, and do everything we can to get as many services in their home so that they don't have to go to a nursing home. We don't want them to. If it's the right place, yes. But if home is the better place for them and where they want to be, we want to provide services there.
You just jogged my brain, so I'm gonna call out Tammy a little bit here. If you would be willing to maybe share, because you did a lot of work in the community getting vaccines and vaccine outreach and everything. Do you know about some of the barriers getting vaccines right now? Some of those trends going on?
I mean, it's widely available. You can, the all the pharmacies are providing them. Only thing I can think of will be transportation, but then a lot of the public transportation like Metro and SARTA are providing free transportation. They're even having mobile vaccine clinics. So I don't see a lot of like, there's issues with getting the vaccine.
Mhm.
Yeah, it's just people trying to get them to get it. Yeah.
I think Tracy can speak to our education of what we're doing with case managers. Sorry, Tracy, I didn't mean to throw you right out there. Our education with our case managers on how do we talk to people about the vaccine. You know, we've heard everything from it has a chip in it to the long-term side effects are going to kill us all. What, Tracy, how do people, how do your case managers speak with people in the community and kind of calm those fears?
Yeah, so I mean, obviously we look at the science and we look at all those reputable sources of information and man our care managers with, you know, fact sheets and tip sheets and even, you know, some sheets on kind of how to do that motivational interviewing and really to listen to our folks, you know, what are their concerns? Why are they apprehensive about getting it? Are there barriers to them getting it? And how might we mitigate those barriers and you know, eliminate that? But just lots of conversations, lots of meeting people where they're at, and supporting them ultimately, whether they want to get the vaccine or not, just supporting them in that decision.
It is difficult. It's difficult to help people understand what's out there. There's just a wealth of information. And as Tracy mentioned, reputable sources, and that's not Facebook. That is the CDC and other places like that. We want to be sure that we're giving correct information, which is consistent and science-backed. Courtney, did you have other ones that we wanted to talk about? I think we've covered quite a bit today.
Yeah, I agree. Yeah, if anyone has any other questions or anything, open it up for that. But I think that was a lot of good information, a lot of things to keep in mind moving forward. We'll advance the slide here. And if you have any questions, feel free to pop them in the chat or stick around. But keep this date in mind. Our next first responder meeting is going to be Friday, November 19th at 1 p.m. So more information will be coming out for that at the beginning of November or end of October in that area. My contact information is on this slide if you have any questions or if you have someone that you would like to get on our email list so that they keep receiving these emails, or if you have any ideas about topics for future meetings. I have a couple in mind for November, but for 2022, hopefully we'll be in person. Hopefully we can get some trainings in. We've tossed around the idea of a dementia-friendly training, so we can keep an eye out for that as well. And then the Aging and Disability Resource Center phone number and email is on this slide as well. And that website to do the referral is in the chat. I'll send it again. So you can keep that in mind, but thank you everyone for coming. I think Carla did a really great job of covering a lot of the things that might have been on your mind. And I will record this and send it out to everyone next week, so you have that and can share it with anyone who wasn't able to make it today. Oh, good. Teresa's and Cassandra are being trained on dementia friendly. A little brainstorm for you. We're trying to partner with the library for dementia friendly in 2022 and hopefully do some sort of community event in person, working out the details now. So that would be really great. Having a couple people who are trained would be great in attendance at that as well. But that's all I have. So I'll
Thank
put you loose for your Friday.
Yeah. Thank you, Courtney. I appreciate it.
Yeah, thank you. And thanks everyone for coming and have a great weekend.
Thank you.
Thanks.